Did you know that a fruit sitting in your kitchen right now could be silently increasing your stroke risk if you're over 65? I'm not talking about some exotic superfruit or processed junk food. I'm talking about a common fruit that millions of seniors eat every single day, completely unaware of the hidden danger lurking inside. What I'm about to share with you shocked even me when I first discovered it. And by the end of this video, you'll understand why your doctor might never have mentioned this critical connection between certain fruits and stroke risk in older adults. Before we dive into this potentially life-saving information, I need you to understand something crucial. What you're about to learn isn't meant to scare you away from all fruits. Fruits are generally healthy and beneficial for most people, but when you hit a certain age, your body processes things differently, and some foods that were once perfectly safe can become silent threats to your cardiovascular health. The fruit I'm talking about is grapefruit. Yes, that tangy vitamin C-packed citrus that's been marketed as a health food for decades. For seniors, especially those taking certain medications, grapefruit can create a perfect storm of conditions that dramatically increase stroke risk. And here's the really disturbing part. Most people have no idea this is happening inside their bodies. Let me explain exactly how this works, because understanding the mechanism is crucial for protecting yourself or your loved ones. Grapefruit contains compounds called furanocoumarins, particularly one called bergamottin. These compounds have a unique and dangerous ability to interfere with an enzyme in your intestines called CYP3A4. This enzyme is responsible for breaking down and metabolizing many medications before they enter your bloodstream. When you consume grapefruit, these compounds essentially hijack this enzyme system. They bind to the enzyme and disable it for up to 72 hours. Think of it like putting a wrench in the gears of a finely tuned machine. Suddenly, medications that should be processed and regulated by your body start building up to dangerous levels in your bloodstream. For seniors who are already taking multiple medications, which describes the vast majority of people over 65, this creates a cascade of potentially deadly interactions. Blood pressure medications become too potent, causing dangerous drops that can trigger strokes. Blood thinners reach toxic levels, increasing bleeding risk in the brain. Cholesterol medications build up beyond safe thresholds, causing muscle breakdown that releases proteins into the bloodstream, further increasing cardiovascular complications. But here's where it gets even more concerning. The effect isn't immediate. You don't eat a grapefruit and immediately feel sick. The danger builds silently over days and weeks. Your medication levels slowly climb higher and higher, putting increasing pressure on your cardiovascular system until something gives way. By the time symptoms appear, you might already be experiencing a stroke or other serious cardiovascular event. The research on this is absolutely clear, yet somehow this information hasn't reached the general public. Studies have shown that grapefruit consumption can increase blood levels of certain medications by 300 to 700%. Imagine if your blood pressure medication suddenly became 6 times stronger without you knowing it. Your blood pressure could drop so low that your brain doesn't receive adequate blood flow, triggering what's called a hypotensive stroke. Similarly, if you're taking anticoagulant medications like warfarin, grapefruit can cause these drugs to accumulate to dangerous levels. While you might think stronger blood thinning would prevent strokes, the opposite can happen. Excessive anticoagulation can cause bleeding strokes where blood vessels in the brain rupture instead of becoming blocked. The most commonly affected medications include calcium channel blockers used for blood pressure, statins for cholesterol, certain antiarrhythmic drugs for heart rhythm disorders, and immunosuppressants. If you're taking any of these medications and regularly consuming grapefruit, you could be unknowingly playing Russian roulette with your cardiovascular health. What makes this situation even more tragic is how preventable it is. Unlike many stroke risk factors that require complex medical interventions, this one has a simple solution: awareness and avoidance. Yet millions of seniors continue consuming grapefruit daily, completely unaware of the potential consequences. The pharmaceutical industry has known about these interactions for years. In fact, many medication labels now include warnings about grapefruit consumption, but these warnings are often buried in fine print that many patients never read or understand. Healthcare providers sometimes mention it briefly during consultations, but the message often gets lost among other instructions and information. Here's what's particularly insidious about this situation. Grapefruit has been heavily marketed as a health food, especially for weight loss and immune support. Many seniors specifically choose grapefruit because they believe it's helping their health. The irony is heartbreaking. People are trying to do something good for their bodies and unknowingly increasing their stroke risk in the process. The timing aspect makes this even more dangerous. Unlike some drug interactions that occur immediately, grapefruit's effects on medication metabolism can persist for days after consumption. This means you could have a grapefruit on Monday morning and still be experiencing altered medication levels on Wednesday or Thursday. Many people don't make this connection when timing their medication schedule. Even more concerning is the fact that different people metabolize these compounds differently. Genetic variations mean that some individuals are more susceptible to grapefruit-related medication interactions than others. Unfortunately, there's no simple test to determine your personal risk level, which means the safest approach for seniors taking medications is complete avoidance. The research also shows that the amount of grapefruit doesn't necessarily correlate with the severity of the interaction. Even small amounts can trigger significant enzyme inhibition. This means that having just a glass of grapefruit juice or a few segments of fresh grapefruit can be enough to cause problems. It's not like other dietary concerns where moderation might be sufficient. What should you do with this information? First, if you're over 65 and taking any prescription medications, check with your pharmacist or doctor about potential grapefruit interactions. Don't wait for your next scheduled appointment. Make a specific call or visit to discuss this issue. Bring a list of all your medications, including over-the-counter supplements, because grapefruit can interact with more substances than you might realize. Second, read your medication labels carefully. Look for any warnings about citrus fruits or grapefruit specifically. These warnings exist for a reason and should be taken seriously. If you're unsure about any warnings or interactions, ask your healthcare provider for clarification. Third, consider alternatives if you enjoy citrus fruits. Oranges, lemons, limes, and other citrus fruits don't contain the same problematic compounds found in grapefruit. You can still enjoy the vitamin C and other benefits of citrus without the associated risks. Fourth, be especially cautious about grapefruit containing products beyond just fresh fruit. Grapefruit juice, grapefruit-flavored medications, certain herbal supplements, and even some cosmetic products can contain these compounds. Read ingredient lists carefully, and when in doubt, avoid products containing grapefruit extracts or derivatives. The broader lesson here extends beyond just grapefruit. As we age, our bodies become more sensitive to various substances, and foods that were once harmless can become problematic. This is why regular communication with healthcare providers becomes increasingly important as we get older. It's also why staying informed about potential interactions becomes a critical component of healthy aging. This information isn't meant to create fear or anxiety about eating healthy foods. The vast majority of fruits and vegetables remain beneficial for seniors. The goal is to make informed decisions based on your individual health situation and medication regimen. Knowledge is power, especially when it comes to preventing serious health complications. If you found this information valuable, please share it with other seniors in your life. This is the kind of critical health information that can literally save lives, yet it's not widely known or discussed. Consider subscribing for more senior health content that you won't hear about in mainstream media. Remember, small changes in awareness can lead to massive improvements in health outcomes. Something as simple as avoiding grapefruit could be the difference between maintaining your independence and suffering a life-altering stroke. Your health is worth taking these precautions seriously, and now you have the knowledge to make informed decisions about your diet and medication safety.